So I'll be talking on Lippy View and Lippy Flow. I do not have any financial interest on this. So basically, if you see the DUCE2 data, the overall prevalence of MGD is 38 to 68% over the year of 40. If you see the MGD workshop data, there are various population-based studies data, and they show that the prevalence is between 3.5 to 69%. And also, there are various risk factors which may be 18 to 60% of the cases. We did our study long time back, and we had seen that it is a hospital-based population, and we have seen that over the age of 30 years, the prevalence is around 31%. So if you see the tear film diagnostic, there are 43 pages document in the DUCE2 report, and anyone can, it is a freely open access document, so anybody can go through this. And there are so many variations, so many controversies are there in the diagnostic methodologies. So, and the investigation, there is an algorithm, and you see that you have certain questionnaires, then you go gradually and you do certain tests. Then you have to classify as evaporative dry eye or aqueous deficiency dry eye. And then you go to your treatment plan. So the available treatment for MGD, starting from ointment, lubricant, oral doxycycline, warm compress and massages, then external heating, packs, intense pulse light or IPL, then Lippy flow system is there, mammalian gland expression, this is mechanically. Then for Demodex, we have tree oil and omega-3 supplement. So these huge lists are there, and accordingly you go stepwise as per your grading of dry eye and mammalian gland dysfunction. So now I am coming to Lippy View and Lippy Flow. Lippy View, currently we are using actually Lippy View 2. It is a second generation machine, and it has, everything is automatic. If it has got different system, and actually the technician used to do it, and it gives some information about the mammalian gland functions. So it has actually three components. One is interferometry and lipid layer thickness, and second one is blink dynamics, that is called functional component, and another one is the structural component, that is the infrared mammography with some trans-illumination devices. So the interferometry, actually it is just like if you put oil in water, that kind of effect. And when the machine throws the white light, it shows the color pattern, and lipid layer thickness actually calculated from those color patterns. Normal LLT or lipid layer thickness is more than 60 nanometer. So it is basically the whole machine is doing that, nothing with us or technician. So if you see this two videos given by them, tear signs, if you see that the interferometry or interfringe pattern of these two tear film is different in, and also it gives actually 20-second measurement, and then counts the partial blinks, how many of them are partial blinkers, how percentage wise, and change of lipid layer thickness with each blink. And this is also, you can show to the patient how your that lipid layer is actually happening. You can videograph it and show to the patient for better understanding. So there are lipid layer things, that some reference values are there. Normally, if it is less than 60 nanometer, there is 90% specificity for mammalian gland dysfunction, and also partial blink ratio. That is also important. I will show some photographs, and that then if it is more than 40% partial blinkers, then you have to train or you have to educate the patients about the conscious blink, and that is called conscious blink training. And that is the LLT and tear film dynamics. This is actually the mammography part. Mammography, it is direct, and if you see that it uses the infrared light, and it is also for the lower lid. There is also the transfiltration system is there, so you have got better contrast. So these are some photographs. If you see that the top one is beautifully, there is no gland dropout, and you see this beautiful glands, and then you can call it normal, then it is mild. If you see that there are certain area of dropout, this is mild dropout, then moderate dropout. Here many glands are missing. Then severe dropout, you can see only the mammalian gland just near the mammalian duct opening. Whereas it also shows us the dilatation of glands. These are the two parameters, dropout area and the gland dilatation. And you see that there is no dilatation in this. In this particular second photograph, you will see there are some dilatation. And in the third one, there is moderate dilatation, and fourth one is severe dilatation. And if you see there are certain black spots, these are actually blocked gland. So distal part is actually dilated. But the only problem with Lippy View 2 system, that machine cannot quantify. You have to calculate yourself and tell the patient, okay, your half of the gland or your 30% of gland is blocked, or 30% black gland dropout areas are there. It is just clinical explanation. It gives beautiful photographs actually in A4 paper. So you can actually show the patient, and always keep a normal reference, normal gland structure, and that there is no dropout and there is no dilatation. And if you show that picture with the patient's picture, they will easily understand what is wrong with their eyes with the mammalian glands. This is actually, you see that this was done. This is my photograph, that both the LLT in the left eye is 53, right eye is just borderline. I am totally 100% partial blinker. And this C factor is actually how your photography and everything is, coefficient factor is, normally it should be more than 0.9. That means your capturing the photograph is good. So reliability of the test is good if the factor is more than 0.9. So I am 100% partial blinker, and also my LLT is borderline. So this is important in MGD. So this is the picture. If you see that there are so many glands, there are dropout areas in the upper lid, in the lower lid also there are dropout areas. And if you see that the regularity, it is highly tortuous, and many of the gland openings, if you see the upper lid margin border along the gray line, you see that there is actually some blocked gland is there. So that is the Lippy View system. The Lippy Flow, actually the treatment part, it is the combo machine. Actually Lippy View shows you the defect and Lippy Flow treat it. So it is actually gives the thermal and mechanical stimulation at the same time for all 4 lids. The temperature is between 41 to 43 degrees Celsius, and the massage from the outer lid it is actually giving a pressure of 6 psi. It is a pulsatile kind of pressure. The cycle is for 12 minutes. This single 12-minute treatment is effective for MGD patients. So it is a 12-minute cycle. Whole procedure takes about 20 minutes to fit and then setting the patient, etc. How does it work? As I told, thermal pulsation, then heat from inner side, and massaging of the lips. So this is the activator. You see this device. It is for single use. This is vault corneal shield to protect the cornea. This is the lead warmer here, and you see the silicone inflation massager. So this is a small video. You see that temperature is rising, so there is a small liquefaction of the meibomian secretion, and this goes on like pulsatile manner, and it has a definite cycle of giving this pulsation. So it all does automatic, nothing to do with the technician, only you have to put a topical anesthetic agent and fit the thing. What literature says? Literature says that it is effective. It is effective. There are few studies available, but long-term studies, only one study is available, and they say that the long-term effect for single thermal pulsation up to 3 years. But it is from this study. But the company people used to say that it will go for 1 year. So patient might require the same treatment after 1 year. But when I have taken 2.5 years back, still now it is not required, but probably my symptoms has increased recently because of overuse of digital devices in last 1 year. So probably I require second treatment maybe within 2-3 months. Then there are other, like if you can combine with it with oral doxycycline for a 3 months course, it is better effective. Then also it gives a compliance for the contact lens user. So they are happy if they use it. Then it is also effective post laser vision correction, where there are the patients with recalcitrant dry eye symptoms, and many patients are happy with this kind of treatment. And other treatment, they also said that it is effective both in obstructive and hypersecretory lacrimal gland dysfunction. Also, recent studies, this is in Cornea Journal, just few months back, and they said that Lippy flow only and meibomian gland expression manually immediately after Lippy flow. They compared the two groups, and they have shown that meibomian gland expression immediately after Lippy flow actually better. So after this report, I am actually starting this giving. So ask the patient to come back in the clinic and put a drop of topical anesthesia with your thumb and one earbud. You just express those glands, because all the meibomian secretion are liquefied at that particular point of time. So the patients they have a very good follow-up in this second study, and very helpful. So in the clinic, what will you tell? So whom to send for investigation? Evaporative dry eye. But before sending them, you should have all complete dry eye workup, educate the patient about the procedure, explain the prognosis, and from there probably you will get some of the patients who are potential for Lippy flow treatment, and tell them about MGD related study. Whom do you treat? They should understand the goal of therapy, willing to modify the lifestyle. This is very important. Affordability issue is there with some of the patients, and you have to tell the patient this you need a repeat treatment after 2 to 3 years. So who are the actual potential candidate? IT workers. And probably nowadays for last 1.5 years, we are doing most because of use of digital devices very much, 12 to 16 hours, refractive surgery patients, and some of the older patients who used to come back to you again and again after beautiful multifocal surgery or beautiful cataract surgery, and you see that nothing is there, that age-related mammalian gland dysfunction is there, so you treat them. They will be happy. Whom not to treat? Absolutely, I showed the photograph, extensive dropout with extensive gland dilatation. Probably it will not help. Aqueous deficiency, dry eye with definite Sjogren or rheumatoid group of disorders, and patient profile and level of understanding is inadequate. So take-home message is Lippy View to guide therapy and educate patients. Choose patient counseling, and you have to tell the patient treatment to benefit. There is a lag time of 2 to 3 weeks. Patient will feel better after 2 to 3 weeks. Reduce drop frequency, does not eliminate the need of them, and educate the patient about the blinking, conscious blinking. Recently, too much industry push up for MGD and also a concern, and also the recent concern of COVID-19. So you have to be very careful about handling this kind of patient. Thank you very much for your patience hearing.